And welcome back. Listening to Life Unrehearsed. Matt Delavecchio here. Thank you for tuning in on a gorgeous weekend. Hope you're enjoying your long weekend out there. All right, as the prevalence of chronic pain in Canada is projected to reach up to 8.3 million individuals by 2025, just around the corner, understanding and addressing the topic of pain becomes increasingly important. Well, Dr. Mark Ware, Associate Professor at the Department of Family Medicine and Director of the Interdisciplinary and Alan Edwards Pain Management Unit, does research, and very interesting research, that dives into the scientific basis of pain and management strategies to tackle it. And earlier this month, Dr. Ware gave a presentation entitled The Challenge of Pain at the Department of Family Medicine in collaboration with the St. James Literary Society. Dr. Mark Ware, welcome to Life Unrehearsed.
Hey, Matt. Thanks for having me on.
Well, thank you for joining me. Boy, oh boy, as our population ages, pain becomes an issue. It's always a concern, but it seems as our population ages, the topic of managing pain becomes very important. And you've gone to the next level, and you really got into explore the scientific basis of pain and its management strategy. So what led you to do this?
Well, I think the first place to start is the need, because there are so many people out there, as you pointed out, living with pain every day, and understanding why they have that pain and what the strategies are that we can use and that we can use with patients to try to address it is a major challenge. It's more common than combinations of cancer and heart disease. So it's something that 1 in 5 Canadians lives with every day. So while we're enjoying a lovely weekend, there are a lot of people out there who are living in pain every day. And I think that's a really important challenge to try to address.
Yeah, and we're going to talk about some of those challenges and how to address it. I'm very interested. It seems to be, we get a diagnostic symptom of pain, but then there's a shift to a chronic condition. And so can you explain the difference of the two?
Yeah, it's a great question, because I think we all know, everybody listening to this program will know what pain feels like. We've all felt it. It's important because it tells us something's wrong. We've injured a tissue, we've burnt ourselves, or we've hit our finger with a hammer. We know what that pain feels like. And that's acute pain. That's immediate response to an injury. When it goes on longer than the duration of healing, so you'd expect an injury to take, some 10 days, 2 weeks, sometimes a couple of months. A surgery can take months before they heal. But there's a time at which you'd expect that pain to go away because the tissue's fixed. For a lot of people, the pain continues, and we call it chronic pain because it's arbitrary, 3-6 months. But beyond the point of healing, then that pain suddenly isn't telling you an important message anymore. It's become its own disease, and that's really, really hard to recognize.
That's very interesting you bring that up, because I guess when you shift from that diagnostic, that hurt, that's immediate, it, and then all of a sudden you start getting into this chronic condition,
Yeah.
and you start losing those warning signs, correct?
Well, the warning signs are still there. They just don't have the same meaning. It's like, well, why do I have the same? Why is my, back still hurting me? And you've seen lots of doctors, and most medicine is about trying to figure out. Pain's the most common reason we go to see a doctor, to find out what's wrong. So most of the time we're figuring out what's causing that pain, and the pain goes away. But for an awful lot of people, when you go looking for the cause of pain, you can't find anything obvious. And there are clusters. There's the classic pain around something's injured or damaged. You have pain, and sometimes that compares to pain, the persistent hip pains, and some pain caused by persistent inflammation. And that's a nociceptive. That's relatively easy to treat with medication blocks, and we can break the pathway with procedures. But there's another kind of pain where it's the nerve itself that's damaged, and people with diabetes or shingles have a damaged nerve, and so there's not really a trauma. There's just a nerve it's like an electric signal that's firing without necessarily any cause, and it's firing by itself. That neuropathic pain requires a whole different strategy, different medications, different approaches. That's a different kind of pain. And there's a third one, which is relatively recent, which is called nociplastic pain. And this is based on the idea that most of us have the ability to suppress pain. If you're watching a hockey playoffs, or you watch a sports team play, or even seeing people in the military, they put themselves through incredible pain, but they're able to push the pain away while they continue the game, playing, doing the job, doing the work. Have this ability to suppress our own. And when that fails, the pain that continues, and we don't suppress pain. So people feel pain everywhere because they're not dialing the pain down. It's like their volume controls are turned way up. And this is a third category of pain where just the volume of pain signals is higher than our ability to suppress it. And that's a really challenging pain to treat.
Talking with Dr. Mark Ware about the challenges of pain, a pain specialist, and Dr. Ware speaks to many organizations, including the one you just did called The Challenge of Pain. That was recently done earlier in the month for the St. James Literary Society. And Dr. Ware, I guess, there are gaps that you would consider in our knowledge of pain, and it affects our treatment, doesn't it?
Mm-hmm. Yeah, and I think some of the gaps in the knowledge are we beginning to fill by being more tuned into what patients are telling us. I think for a long time we've kind of used pain as the signal, trying to figure out what's going on, but we have to listen to patients who live with pain every day tell us what it is they're actually feeling. How is it affecting not just their bodily function, but their sleep, their mood, their relationships, their job. Pain, when it's starting to become chronic, can interfere with a huge range of things. And people have different ways of expressing that. The fun thing about the piece that I did with the Department of Family Medicine and the St. James Society was we talked about communication, about ways that patients can express their pain, words that they choose to use. And there's a bunch of examples in the literature about people trying to find ways to express pain. We know they talk about Shakespeare and Keats and poets can talk about love easily. But when you try to express pain in literature and art, it's really hard. There are some powerful artists and musicians and writers who are trying to put pain into language. So we really focused in on some interesting ways to listen to the story of pain. And maybe in that we can understand more what the patient is feeling and suffering, right. And we can address that as well as trying to tackle the pain signal.
Address it through that proper communication and then recommend the right treatment. Okay, we have to wrap it up very, very quickly, but I want to mention the McGill Pain Questionnaire. Can you quickly tell us about that?
Yeah, well, it flows on from the communication. So Ron Melzak was a psychologist at McGill years ago, listened to patients describing their pain, and they said it was burning or cussing. He organized 72 words into categories, and we now use those words to understand the type of pain, and it can help us direct whether this is the injury pain or whether nociceptive or this new type of thing. The words people use to describe their pain can help us understand and the type of pain, but the severity of it. So really, the story is listening, learning, and working together with patients to find strategies that help them, because everybody's unique. There's no one size fits all when it comes to pain management.
McGill Pain Questionnaire, great way to be able to help you communicate your pain. All right, we're already out of time, Dr. Ware. I want to thank you very much for joining me on Life Unrehearsed.
Great. Thanks for having me. Have a great weekend.
Thank you. You too. This is Dr. Mark Ware, Associate Professor at the Department of Family Medicine and Director of the Interdisciplinary and Alan Edwards Pain Management Unit. Next week on Life Unrehearsed, recognizing signs of the many forms of elder abuse and how you can make a difference in supporting our vulnerable population. I'm also going to be talking about support for caregivers with one of Quebec's largest resources for caregivers called L'Appui, and the author of Advocacy in Aging, a fascinating book providing you with the blueprint for successful aging, including proper financial and estate planning. I want to thank you for tuning in to Life Unrehearsed. As a reminder, for all your inquiries or assistance with life transitions, home care, and the senior living industry, be my pleasure to help. You can find out more if you look up Lianas Senior Transition Support. That's Lianas, Lianas, Senior Transition Support. Many thanks to Demetra Kritzidemus and Dario De Felice. Great job putting on the show today, guys. You could listen to Life Unrehearsed here on CJD 800 every Sunday at 4 p.m.